Imagine you're maybe a healthcare administrator or an educator. Things move fast.
Right.
And suddenly you need critical info, like right now, for a big decision.
Yep, happens all the time.
But, traditional research, that takes ages, months, maybe years.
Long, way too long when the need is urgent.
Exactly. You needed that data yesterday.
Yeah.
So what's the move? Today, we're diving deep into exactly that.
The need for speed in research.
Yes. Specifically, how crucial info for, say, health professions education can be gathered, analyzed, and delivered super fast. It's about getting properly informed when time just isn't on your side.
And that's where what we call rapid research methods, RRM, come in. It's a growing field.
RRM, okay.
Yeah, and this isn't about, sloppy work. It's about focused research, usually done in under 3 months, sometimes even within 90 days.
Wow, 90 days.
Seriously. The need really exploded during the pandemic. Remember, decisions needed now.
Oh, absolutely. Real-time data was everything.
Exactly. So RRM tries to strike that balance, getting useful knowledge out quickly with limited resources, but still doing it rigorously.
Okay, that makes sense, especially in a crisis. But I have to ask, rapid research, doesn't that make people worry about, well, the quality?
That's the first question everyone asks. And it's fair.
How do you make sure it's not just quick and shallow?
Well, it's fundamentally a pragmatic approach. The focus is laser sharp, provide useful knowledge for the people making the decisions.
Useful knowledge, okay.
It's really important to stress, though, it's not a replacement for longer, deeper studies, like deep ethnography or massive systematic reviews. Those have their place.
Right. Different tools for different jobs.
Precisely. RRM is more like a clever adaptation of existing methods we already trust. And rigor. That comes from being totally transparent about how you did it and really upfront about the limitations.
So you tell the decision maker, here's what we found, here's how, and here's what this can't tell you.
Exactly. Then you, the user, can judge how much weight to give it.
All right, so if it's not just research light, what are these clever adaptations? How do they actually speed things up without compromising integrity? Let's unpack the how.
Okay, several key things. First, focused questions. Big one.
Meaning?
Meaning you talk to the decision makers really early, really clearly, figure out the absolute must-know information, tear it right down.
Get rid of the nice-to-knows.
You got it. RRM shines for exploratory stuff like, why aren't learners getting this new concept? Or clarification studies, how did this program actually work on the ground?
The why and how.
Yes. Less so for the big did it work questions. Yeah. Those usually need more time, maybe experimental designs.
Okay. Sharp focus from the start. Makes sense. What else speeds it up?
Then there's streamlined data collection. Big time saver.
How so?
You often recruit people through networks you already have, much faster than cold calling or broad advertisements.
Leverage existing connections. Smart.
And you might use purposive sampling. So intentionally picking a few key people who you know have crucial insights.
Not just random people, but the right people.
Right. And get this, there's a concept called information power. It suggests you don't always need tons of interviews.
Oh.
Yeah, sometimes even 6, maybe 8 really well-chosen interviews can capture the main themes if they're pretty consistent. It changes how you think about needing like 20 interviews for saturation.
That's a shift. Fewer, richer interviews, potentially.
Potentially, yes. And then technology helps massively. Auto-transcription software. Game changer.
Like Otter.ai or Teams transcription.
Exactly. Turns audio into text super fast. Think of the hours saved compared to manual transcription.
Oh, I can definitely imagine. My fingers hurt just thinking about old school transcription. But does software miss things? Nuance. Jargon.
Good point. It's not perfect, which leads to the next adaptation. Efficient data analysis.
Okay. How do you analyze faster?
Often, analysis starts while you're still collecting data. It's iterative.
Not just waiting till the end.
Right. You might use structured templates, maybe predefined categories to slot data into quickly, or specific rapid methods.
It's like them.
There's one called RADAR, Rigorous and Accelerated Data Reduction. It's a systematic way to condense qualitative data quickly.
RADAR.
Catchy. And another is RITA, Rapid Identification of Themes from Audio Recordings. This involves just listening to short, maybe 3-minute chunks of audio.
Without transcribing everything.
Exactly. You get the gist much faster. And to keep it rigorous, researchers often use a critical friend.
A critical friend?
Yeah. Another researcher who listens, challenges assumptions, asks tough questions, helps keep you honest and spot blind spots.
Okay, so you gather fast, analyze fast, but with checks. Now, the research is done. How do you get these insights to the decision makers so they actually use them? A dense report probably won't cut it.
Absolutely not. Presentation is critical.
Yeah.
Forget the 50-page report sometimes.
So what works?
Well, short reports, executive summaries, sure, but also more creative stuff. Infographics are huge, visual, easy to scan.
People like visuals.
Definitely. Short podcasts, maybe little videos with sound bites from participants or key findings. Very digestible.
Like audio highlights.
Yeah. And what I really like is using personas.
Personas.
Treating these little character sketches, vignettes based on typical respondents, it makes the data feel human, relatable.
Oh,
Much more impactful than just stats, helps decision makers really grasp the implications.
that sounds powerful, bringing the data to life. So this deep dive really shows that these rapid research methods, RRM, they're a really practical, pretty powerful tool, especially in fast fields like health education. It's about being smart, adapting, and zeroing in on what's truly useful right when it's needed.
It is, and it brings us back to the core idea, usefulness, which raises a final thought, really, for you listening.
Oh.
Ultimately, how useful these RRM findings are depends on your judgment as the user. So the question becomes, how would this kind of timely, focused information actually inform your next decision? And maybe more importantly, what new questions does it make you want to ask?